Okay, so now we're going to go over what the consultation looks like, just so you can get an understanding of what it's like. And sometimes you might be doing part of the consultation as well. So if you look on here, it tells you under the chief complaint, are they having headaches, jaw pain, neck pain, shoulder pain, wrist pain, etc., and there's plenty of room for extras. Okay, so the first thing I would come in, I would say, hi, Mrs. Stark. Miss Stark, nice to meet you. Welcome to the office. I'm Dr. Casabona, and I want to thank Mary Jones for referring you to our office. And so the first thing I'm going to say, instead of saying, what is your chief complaint, I'm going to say, how may I help you? And I'm going to stop, and I'm going to listen, and I'm going to look her in the eyes, and I'm going to lean in and pay attention. So how can I help you? What brings you to our office today?
I've been having hip pain.
Hip pain. Which hip is that?
My left hip.
Left hip. So I'm going to write left hip in here. And I'm going to ask right here where it says onset. I'm going to ask, how did that happen? When did that start? Tell me a little bit about that, please.
It was about 2 years ago. I decided to deadlift heavy and play 2 games of volleyball.
Okay, so I'm going to write onset 2 years, deadlift heavy. I'm going to try and copy exactly what she says, and then 2 games of volleyball. Okay? And then I'm going to move down into what makes it better, what makes it worse. So when you have that hip pain, tell me some things that either aggravate it, or then tell me some things that actually make you feel better. What have you done?
Playing volleyball or any kind of like stair climbing aggravates it.
Okay.
And to make it better, like some stretches and physical therapy exercises help it.
Okay. So a lot of times I'll repeat back what they said. So you're having pain in your left hip. It came on about 2 years ago with deadlifting and heavy deadlifting and 2 games of volleyball. You said that when you play volleyball or do some stairs, it increases the pain, and stretching actually makes it feel better. Okay? Mm-hmm. Now, can you, and I also like to do this, can you actually show me where it hurts you?
Yeah, it's just right here.
Okay, so this is a great teachable moment because the actual hip is right here. So she's pointing more into like a sacroiliac joint, and most patients never went to school and they don't know that, right? It's no big deal. But hip pain a lot of times will hurt here, maybe in the groin. So now I'll actually palpate that area. I'll say to the patient, is it okay if I touch that? And I'll get in there and I'll dig in, and I'm gonna say, oh yeah, that's really tight. Is that tender when I press in there? Just find the painful spot, and I go, okay, sit down here for a second. By the way, that makes me think, then I go right into this next point. Does that ever give you pain that radiates down the leg, the thigh, the toes, any numbness and tingling, any type of sciatic pain, shooting pain?
Yeah, to my ankle.
Okay, so that's very important. Then on the form here, there's a part about radiation. Is it going to the lower extremity? Yes, and it goes to the left ankle. Okay, and then here, I forgot this part, the quality of the pain. Would you say that it's a sharp pain, a dull pain, a muscle spasm, an ache? How would you describe that?
It's like an achy pain.
Okay, so I'd circle ache on there. And then I move into this part here where it says Desjardins triad. Do you have any pain when you cough or sneeze or push to go to the bathroom or yawn? So I'd write negative there. Is your pain in the left hip, is it more typically stiffer in the morning and then you move around and take a shower, it goes away? Or do you feel it worse at the end of the day?
It's pretty constant.
Constant, okay, and I would write constant in here. And then another quick question for you, Serena. Does it hurt when you sit too long, say at the computer, and you go to stand up? Or does it hurt more like, say, if you drive to Phoenix and you get out of the car, would you have increased pain and stiffness in your hip?
Driving.
Yeah, okay, so I put driving down in here. And then right now, on a scale of 1 to 10, 10 would be like a broken bone. How would you grade that pain right this moment?
2.
2, so that's pretty low, okay. What's the worst it's ever gone to?
8.
8, wow. You see, and then you really want to know about that. Geez, what was going on at that time? What was hurting with, more like working out, or just right when it happened, or?
Playing too much volleyball.
Okay, I'd like to write that down. What's the best it's ever gone to?
Like a 1, 2.
Okay, good, it's all right, 1 to 2. On average, what does it feel like?
Well, 1 or 2, unless I play volleyball.
Okay, and before 2 years ago, would you say that was an actual 0?
It was 0.
Okay, good. All right. And the percentage of the day that you feel this, the waking hours, would you say you feel it 50% of the day, 75% of the day, 100% of the day?
50 to 75.
Okay, that's good. So we circle that. And then anything else complicating this in your life? Do you have anything else that you've been diagnosed with? Things like osteoporosis, arthritis, high blood pressure, any history of cancer?
Nope.
Okay, so we're just going to mark no, 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 no. How about in your family line? Is there anything I should know about in your family line?
Cancer, diabetes.
Okay, so who had cancer?
Both grandmas.
Okay. And what kind was that?
Pancreatic, breast
Oh, Lord.
cancer, and I'm not sure what the other one was.
So sorry to hear that, jeez. Okay, and who had diabetes or has
My
diabetes?
paternal grandfather.
So the granddad on the dad's side. Okay. And then, do you have any past histories of significant trauma, like a car accident, a work injury, a sports injury, a time you were knocked unconscious?
No.
You ever been in a car accident?
I have, but it was very minor.
Okay. And how fast was the car going? How much damage?
Probably just 20 miles per hour.
Okay, so now see how I had to dig into that? You never met, she said she didn't have any trauma, but then she has had a car accident. She's saying it's very minor. 20 miles per hour. I would say 20 miles per hour, that's a lot. I have on my computer here a videotape of some engineers that got rear-ended and tested at 10 miles per hour, and they had whiplash and a mild concussion just from 10 miles per hour. So you're 20 miles per hour. That's pretty good trauma. Is there anything else that comes to mind?
No.
Okay. How about sleeping? Do you sleep through the night? Does pain wake you up? Do you sleep through the night
Sleep
without
through the
getting up? Good. Okay. Do you sleep on your back, your side?
My side.
Okay, good. And then, how about past surgeries? Have you had any surgeries we should know about? Hospitalizations, broken bones, anything like that? Okay, so the patient denies that. How about medicines? Are you taking any medicines right now?
Yeah.
Very good. Okay, and then which one of these activities in your life does your hip affect you the most? And I think I know. Is it your work, your household chores, your yard work, your relationships, your volleyball? What area do you feel it the most? I know you already told me about the volleyball. When else do you feel that?
Volleyball and bowling.
Bowling. Okay. And so with the pain, does it ever stop you from bowling or hurt while you're bowling?
Yeah.
Okay. You stop. You've had missed playing volleyball or bowling because of the pain, or? Just-
Volleyball, but bowling it's able to
Okay.
deal with.
So you missed volleyball. That's very important to know. Okay. And one last question here. Have you ever been to a chiropractor before?
Mm-hmm.
Okay. And then I would ask, like, when was your last visit? What was the doctor's name? What kind of technique did they do? How were your results? Did you have any x-rays or MRIs? Have you had any x-rays or MRIs on your hip before?
X-ray.
Yeah. Where was that done?
Fort Huachuca.
Okay. And do you remember what it said?